Any item that will be voted on has been posted on the PPS website under the Board and Meetings tab. This meeting is being streamed live on PPS TV Services website and on Channel 28 and will be replayed throughout the next 2 weeks. Please check the district website for replay times. As of August 13th, Governor Kate Brown reinstated a statewide indoor mask requirement for all indoor public settings, whether vaccinated or not, in order to stop the highly contagious Delta variant from spreading further. Tonight, we have in place mitigation strategies to help keep us safe, members of the public and staff. Board members and staff in attendance are wearing masks, and most, if not all, are fully vaccinated. Thank you. I felt like I was yelling. Board members and staff in attendance are wearing masks, and most, if not all, are fully vaccinated, both at the recommendation of the Multnomah County Health Department. We have air purifiers placed throughout the boardroom, and we have ample space for you to spread out and distance socially in the audience. So good evening. I want to welcome the board, the superintendent, staff, families, students, and guests. Tonight, to start off tonight's meeting, I'd like to share some agreements to help ground us in tonight's meeting and discussion. There should be a slide teed up. In any case, the meeting agreements, I was reminded, and I recognize were brought to my attention that we haven't co-created these agreements. And I hope that we'll see these agreements in terms of how we show up at our meetings as a placeholder for doing the actual work of co-creating agreements that we can agree to. So the agreements have not been fully vetted. I don't see them on the screen, but there's a list of 7. And I don't know, Kara, if you have access. Okay, so thank you. The idea is that as a board, I want us to be able to agree to some meeting protocols, such as, understand why we're talking or not talking, listen to understand and not respond, be willing to make mistakes and be forgiving of those who do, et cetera, et cetera. I think that as we move forward, we don't have to do this work right now in public, but I would like for each of us to give some consideration to what our meeting ground rules will be for this year. We didn't have anything like ground rules in place, and I'm just introducing this idea now in the spirit of improving our own practices. We begin tonight with the board consent agenda. Board members, are there any items you'd like to pull for discussion or discuss? We can set aside anything for discussion and vote at the end of the meeting. Ms. Bradshaw, are there any changes to the consent agenda?
No.
Board members, are there any items you would like to pull from the consent agenda?
I have a question about the College Board, but I don't think it needs to be pulled from the consent agenda.
Thank you. Do I have a motion? Do you want to ask that question now, or should we vote first?
Let's put it on the table, and then I'll ask my question.
Great. Do I have a motion and a second to adopt the consent agenda?
So moved.
Second.
Director Scott moved. Director Constam seconds. The adoption of the consent agenda. Is there any board discussion on the consent agenda?
So I had a question for staff about the College Board contract, and I see that staff is ready. So last year, I know that students weren't able to take the PSAT, and I understand that it's part of our equity vision that we encourage all students to be able to take it and have access. So I'm concerned about juniors who haven't been able to take the PSAT being able to do so this year. And this is, I wanted publicly declare my conflict of interest here. We just had our ethics training that my daughter is a junior. And so it was apparent to me that for her, as she thinks about wanting to take the SAT, it's important that she has an opportunity to practice so that she's prepared for the test. So I asked staff about what can we do for those students who have not yet taken the PSAT to allow access for all students to be able to take the test.
Thank you for the question. Okay.
Sean's trying to talk, Terry. Just keep talking and he'll turn it up.
Thanks for the question. We will be paying for students. We will be paying for students to take the test who are juniors this year who would have who missed out on the opportunity last year to take it. So we'll take care of that. We'll amend the contract.
And I know some families have already, as they've started, doing school pay for IDs and everything, have already paid for the test. I know some families are okay with paying for the test, like mine is, but should people ask for a refund, or what's the process going to be for families?
So we'll communicate with principals the process for how they can refund that money, but yeah, it will be paid for by the district.
All right, thank you so much, Dr. Bird.
Thank you. The board will now vote on resolutions 6362 and 6363. All in favor, please indicate by saying yes.
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 All opposed, please indicate by saying no. Are there any abstentions? The consent agenda is approved. The sound is going out again by a vote of 7-0, with Student Representative Weinberg unofficially voting
Yes.
yes. Thank you. We now turn to student and public comment. Before we begin, I'd like to review our guidelines for public comment. First, the board thanks you for taking the time to attend this meeting and provide your comments. Public input informs and improves our work, and we look forward to hearing your thoughts, reflections, and concerns. Our responsibility as a board is to actively listen. To that end, I would ask each of my colleagues to tuck their phones away during testimony so we can give our full attention to the people in front of us. And I'll do the same. Our board office may follow up with board-related issues raised during public testimony. We request that any complaints about individual employees please be directed to the superintendent's office as a personnel matter. And if you have additional materials or items you'd like to provide to the board or the superintendent, we ask that you mail them to public comment, all one word, at pps.net. Public comment at pps.net. Please make sure when you begin your comment that you clearly state your name and spell your last name, and you'll have 2 minutes to speak. We typically have 3 minutes, but we have enough people on a waiting list that if we can all limit our comments to 2 minutes, we'll be able to hear from more of you. So I appreciate your patience and consideration for that. You'll hear a sound after 2 minutes, which means it's time to conclude your comments. Ms. Bradshaw, do we have anyone signed up for student or public comment?
Yes. We'll start with Xander Levine.
Good evening. My name is Xander Levine, Levine. Good evening, board members. My name is Xander Levine, and I'll start with this. That's a picture I took January 26th, 2021. It was my math class with 30 kids, including myself, with me being the only person who had his camera on. This was how most of the year went. Students did not show their faces, and school basically became a DIY lesson by yourself with no one talking. Here's a clip that I took on that day while looking at that screen. Please listen.
This is online school. That's it. Do my own work. And in a Zoom call. The only one who has my camera on. No one else is talking. And I'm here just doing my work.
That was not healthy. That was the voice of a student who, while in person, loved school, loved learning, and was disappointed and at a loss for words. It's incredibly exciting to hear that we're going back to school full-time, 5 days a week. The thought of being able to reconnect with my friends and teachers in an in-person setting brings a smile to my face. We can't afford to go back to distance learning, or should I say comprehensive distance learning, which was not at all comprehensive. Let me be clear, that's not the fault of my amazing teachers, administrators, or even the district. It's merely the situation at hand, and it can be better this year, with masks, in person, while keeping distance. Online school was depressing, sad, and lonely, no matter how you put it. Even students who had a strong social circle and opportunities to get involved still struggled. Students have endured enough change. Please, remain committed to sending students back to school 5 days a week. Thank you.
Thank you.
Thank you. Oh, we have Cameron Chen.
Good evening. My name is Cameron Chen, spelled Chen. So today I'd like to speak on behalf of many students who I speak with regularly and to encourage the board to move forward with the same fully in-person learning like Xander was talking about. So I first wanted to talk about some parts of my experience as a student during comprehensive distance learning. And I was very lonely. I was the only one in my house for largely the whole entire day. And I am a person that is very involved in Lincoln leadership, in many sports at Lincoln, and I was also on club swimming. But even with all of that, I was still very lonely all day. I felt like I wasn't getting the full amount of education at home that I was when I was in person, and I felt like I was starting to struggle. Being lonely, I could feel that my mental health was starting to deteriorate, and that I was slowly starting to have my grades were slipping a little bit. And me, as someone with ADHD, I struggled deeply with having, since no one was around me to help keep me, focused and in line with my work. I didn't really have the means necessary to really do all of the work that I was supposed to in a very timely manner. So I did a little bit of research, and I think I want to talk about Lollapalooza, which is, as silly as it sounds, a music event that just happened recently in Chicago. And at that event, there were 385,000 attendees who were all vaccinated and or tested 3 days prior to the event. At the event, those 385,000 members were all unmasked. While they were outside, they were unmasked and very packed together at this big music event in large music venues, but still in very close quarters. I think that after seeing what's happened at those at Lollapalooza, I think that at my school, Lincoln High School, which has 200 times less of the people than at Lollapalooza, masked and indoors, I think that it will be a good decision to stay in person. Yeah, thank you. I just want to encourage you all to move forward with the in-person plan. Thank you.
Thank you.
Okay, we have Samantha Coleman.
Hello all, my name is Samantha Coleman, Coltman. Hi, oh my gosh, I'm so sorry. And my name is Samantha Coleman, and I'm the Associated Student Body President at Lincoln High School. I'm here to speak on behalf of my own experience with mental health during the comprehensive distant learning. I want to start off by saying I know I'm not the only student who feels like another year in online learning feels absolutely impossible. Over the past year and a half, I've felt a darkness and wave of anxiety that I've never felt before. Before the pandemic, I did struggle with anxiety, but it was never this severe. Once we fell into the uncertainty of COVID and distance from seeing people in person, it all changed. Not only was there the anxiety of having COVID vulnerable family members, but there was this void of loneliness that no Zoom call could fill. We as kids need the in-person support, not just from physically being around other students, but having the presence of adults that are not just our parents. I love my parents wholeheartedly, but my whole world flipped upside down, even with present parents. Once we started online school, of course, it felt unreal. Not only did it feel unnecessary, as I could not absorb any material, no matter if I was in bed or sitting at my desk, I lost all motivation. Moving into the school year, I felt optimistic and got some help. It was weird. I was never the kid who needed help. I started treatment for my severe depressive disorder and generalized anxiety. I wanted to be optimistic. Grades now counted. Maybe my motivation would return. Spoiler, it didn't. School felt pointless. I would sit in my class, and every opportunity I had, I would turn off my camera and take a nap. I promise you I'm the opposite of this unmotivated, lonely teen I had become. I'm a varsity athlete and a full IB student, but my mental health was so bad that it didn't even matter anymore. However, for the first time in the past year and a half, things got better. When I felt that things got better was during hybrid learning. Me and many other students who I know who fell in the same position as me got the support we missed, and the motivation came back. I just want to say that there was a 400% increase in depression and anxiety in teens during the pandemic, and that we really need to be in person, that it will really make the difference in making our studies possible.
Thank you.
Thank you. We have Kelly McDowell.
And just to double check, are we actually timing people at 2 minutes to allow to hear more testimony? Okay, thank you. Who do we have next?
Is Kelly McDowell here? No? Okay. We'll move to Shelly Reisz.
My name is Shelly Reisz, R-E-E-T-Z. My full statement, along with references, has been sent to the members of the PPS board. I want to start by stating that I fully support PPS's decision to reopen our schools full-time this fall. Today, I'm not only speaking as a parent of a PPS student, but as a researcher who's focused the last decade of my career studying mental health issues of children and adolescents. Over the past 18 months, COVID-19 has created a perfect storm of factors that has led to a sharp increase in unreported cases of child abuse and neglect, as children are cut off from interactions with teachers, confined at home with caregivers and families that are under an extreme amount of added stress. Our nation's system of detecting abuse and neglect is heavily reliant on reports by teachers, who make up half of the mandatory reporters that a child regularly encounters. When schools close down and there are no in-person, face-to-face interactions between children and teachers, child abuse reports plummet, and these children suffer silently. Reports of child abuse and neglect to ODHS dropped over 70% in a single month last March when schools shut down. However, even as the reports declined, there are many reasons to believe that abuse has only increased during the pandemic. Advocates at Randall Children's Hospital are reporting that the cases that they're seeing are more extreme and horrific in terms of the level of abuse. One study showed a significant increase in the incidence of pediatric abusive head trauma occurring in the months after the shutdown started. In addition, our children have been suffering disproportionately when it comes to mental and emotional health. One recent CDC study reports a rise in adolescent suicide attempts during the pandemic. Emergency room visits for attempted suicide for girls aged 12 to 17 were 50% higher than pre-pandemic levels. As parents, our children's safety is our top priority. We need to be considering their health and safety from a whole health perspective, one that takes mental, emotional, and physical health into account. And we as a community have an obligation to protect the children that don't have advocates to speak out for their safety. Having our children back in schools full-time is a huge step towards normalcy that all of our children need.
Thank you.
Thank you. Ginger Hazar.
So Ginger Huizar, Gingrhuizar. I am here as a PPS parent and a special education teacher. I am excited that we are coming back full time because I agree with everything that's been said that I've heard. But I'm also concerned about the way that we come back, because I want us to stay back and not have to shut down and not have a lot of disruptions for kids. We have a lot of children who are still not able to be vaccinated yet. So in our final hours, every school is reporting a different lunch plan. I know that we will have 6 weeks of expected outdoor lunches as we can, but it will rain and kids will not all be fully vaccinated before we're likely to be back inside. Some middle schools have 3 to 6 lunches planned. Some, like the one I'm at, are expected to push over 450 kids into the lunchroom at once, unmasked in the cafeteria. Yesterday, our superintendent reported that we have protocols as quickly isolating, quarantining, and contact tracing, and I have to disagree. Where was that data collected? Because last year, is it the attendance policy where kids could email and be counted as present? Is it when kids went home sick and then returned? Is it when my building had an unstaffed COVID space? Is it when kids entered staff doors and made it to the second floor without a mask? Is it when I watched a kid throw up on the school lawn and their parent walked them to summer camp anyway? Our policies are hardly proven ineffective, but we have to be in proximity to students to understand that. What we have doesn't align with guidelines, and what we need are guidelines that align with lunchroom capacity per square foot as a district, so everybody has the same rules for safety. Why don't we have mask guidelines and provide proper masks? Why don't we have in-school testing protocols and tests available for asymptomatic exposed classes? Why don't we have smaller class sizes and cohorts? Why don't we have a recess mask mandate? And why don't we have an outdoor 3-foot eating policy? And why don't we use COVID relief funds to buy outdoor covered areas for lunches so we can ensure safety for all of our students and not some of our students?
Thank you.
Thank you. We have Leanne Moldovani.
I'm Leanne Moldovani, and thank you for hearing my public comment. So I'm not going to read what I prepared. I listened to what some of the high school students have shared with us, and I feel for them. I really do. I'm a parent of 2 children in elementary school and middle school, and I can relate to the mental health suffering that my kids went through and the ineffectiveness of distance learning. However, it is still unclear to me as a parent what will happen if or when school needs to shut down in the case of an outbreak within a cohort or a classroom or a school. Single parents or parents where there are 2 working parents or parents who have essential worker types of positions cannot turn on a dime when a school shuts down and the kids are sent home either to quarantine or to revert back to distance learning. It causes financial hardship. It causes career disruption. Some cases, my case, I am probably going to lose my job when that happens. So it's highly problematic to not have a plan that's been shared about what will happen if distance learning needs to take place. And for the younger kids, those who are unvaccinated, many parents are unwilling to send their kids back into a public building, and kids are afraid to do so. The online learning academy, which was offered, was not well communicated to many families who did not realize that it was no longer only open to families who have a high-risk household, and therefore never completed their application because they did not think that they were eligible for it. So now they're placed on a wait list. These parents have a week to figure out if they are going to have to make some kind of arrangements, and I would like to have seen some kind of funding or support for those families who need the support at home to support something like the online learning academy or distance learning, because it makes it impossible for those families to make a responsible choice. Thank you very much.
Thank you.
Thank you. Romy Ross. Is Romy Ross here? Right. Nadia Coronado. Linda Mylott.
Hi, I'm Linda Mylott, spelled MAI-LOTTI. I have a senior at Lincoln High School. I first wanted to say the fact that we're even considering not going back to school full-time is a huge surprise for many of our parents. So in the previous board meetings, the lack of support or voices from the student and family is not reflective of how we feel. Once we found out, we all rallied. We emailed every one of your board members, and as well as we organized on change.org a petition for families to sign, and it was taken down within 2 to 3 days. So, but I do want to read from Melora Whittemire. She has a senior, and she emailed each one of you because she is actually a physician. Her son is Kevin Gochi, and she's currently a primary care physician at OSHU, and she's on duty tonight, so I am representing her. We all want to first of all thank everyone for the dedication to our students and their education. I ask you to please advocate and guarantee our student return in-person learning this year. The toll of online education has taken is immeasurable. It will play out and be measured and analyzed for years to come. As a women's health provider, I can tell you countless stories of mothers at their limit committing suicide or contemplating it as they have lost their jobs and are not equipped emotionally or educationally to educate their children. The fallout amongst our youth is yet to be fully tabulated. We pride ourselves in Portland as being progressive, yet if we truly care for the underprivileged and underserved, we would not be questioning returning to in-person education. Teachers are essential worker, just as so many of us are. We have so many examples of successful return to in-person learning across the nation, as well as I would say Judgeo High School, who has been in person for the last semesters. How embarrassing that Portland is the last holdout, a city that refused to return to in-person despite ample evidence of the safety and efficacy to do so. And personally, I understand last year was different, but now vaccinations are available. So I am only really speaking to the high school because I understand certain age children are not able to get vaccinated. And please see that as it's a much more nuance between age groups. And just like we all have to submit our children's immunization records, we're fully supportive of vaccination and testing. Thank you.
Thank you.
Thank you. We have Kelly Chang.
Hi, my name is Kelly Chang, C-H-A-N-G. Oh my God, this is more nerve-wracking up here than like back there. Okay, I'm here tonight to share with you, and by the way, I have 3 children in PPS. During the pandemic, they went from elementary to middle school to high school. So, okay. I'm here tonight to share with you why in-person school is pivotal for many immigrant families. I know growing up, oh my God, I'm so crying. I know growing up, my parents would never have been able to come to these meetings because of work and limited English proficiency. I'm here to hopefully speak for some of them. I came to this country when I was 10 years old. My mom spoke little English while my father, brother, and I spoke none. My parents worked long hours daily. We lived in an apartment on the side of a busy road. My brother and I were both on free reduced lunches and meals. Since I didn't speak the language nor had any friends, school was my whole world. I went there daily to be with other children, to eat lunch, eat breakfast, and to learn English. It was in-person schooling which taught me the nuances of the English language and culture. It was through these daily in-school days which allowed me to eventually make friends and have a sense of belonging to the community. On weekends and on vacation days, I was left alone with my brother in the apartment. We longed for school to begin again as we were very lonely. This feeling of loneliness is what I think most of our students felt during their 1.5 years away from school, from in-person school. As I learned more English and the American culture, I became the translator and the main guide for my parents to navigate through this new country. In-person school does not only provide social connections and academic necessities, it also has a macro effect of integrating and lifting immigrant families. And here's my daughter, who has some words to say.
I have some words that I'd like to share. Having schools closed has really affected me negatively mentally, and I'm really looking forward to them opening again so I can be able to have motivation for my everyday life again because I've been robbed of that.
Thank you.
Thank you.
Thank you. We have Elaine Walpole on a virtual call, and hopefully we can,
Hi,
yes.
can you hear me okay?
Yes.
Thank you so much. My name is Elaine Walpole, Walpole, and I'm a mom of 2 Black students and a former contract facilitator of Black Studies for PPS. What's kind of ironic about what you're hearing right now is that I can't be there to read this in person for the very reason I'm writing it. My family is sick right now, and this didn't really have to happen. On August 10th, our kids went back to school, one of whom is immunocompromised. I was afraid, and despite masks, we've already been fighting illness for a week. Because CDL was unavailable, we were left making the impossible choice to either put their physical health at risk by taking them in or risk their mental health by unenrolling them, losing access to the school community, and being forced back into the school's lottery system. It was a pretty crippling choice, and I pretty much didn't sleep for a week prior to the 10th. I chose to bring them to school ultimately because without a continued CDL option, we felt pressured to provide some sort of socialization, and now I'm regretting that. Please understand the incredible value of having a consistent and familiar online support system right now for them. CDL was not only a safe option, not just from the disease, but it also helped them feel emotionally secure during this really scary time, at least for my kids. They're elementary school age. Now there's no winning, it feels like. It feels like we have to sacrifice one health outcome for another, and honestly, not providing CDL again, as an option at least, during the height of this virus feels like neglect. Kids are dying in the hospital where my sister is a nurse. We could have continued learning in a safe environment if we chose, instead of now staying home anyway, getting tested for COVID after every single cough, sneeze, or nose blow. That is traumatic for them too. We all deserve to feel safe and protected by the leaders of this city, and my family is sick right now because we were not given that option this year. CDL needs to be a mandatory option at least, please. Let me be clear, our brown and Black community is suffering greatly from this disease. There's no time for us to even grieve one COVID death before another death occurs. And yet we are supposed to trust that those in power care for our families, even though the safest schooling option has been stripped from us during the most dangerous time.
Ms. Walpole?
Yes.
I don't want to interrupt you, and I don't know if you heard on our call, we are limiting testimony to 2 minutes so we can hear from more people. We had a waiting list signed up tonight. So
No problem.
I'm sorry to cut you off, but
we're
we're trying to hear from more people, and
No problem.
appreciate your testimony. Thank you.
No problem. Didn't hear the bell. Thank you.
Do we have any additional?
There's nobody else signed up. Would you like me to go through the few people who did not answer, or?
I'm sorry, I'm having a hard time hearing you.
Sorry. That is everybody who signed up. Would you like me to call the few names that did not come up?
Yes.
Okay.
Yes, please.
Okay, thank you. Is Nadia Coronado here? Or Romy Ross?
AJ McCrary. I'm speaking on behalf of Romy Ross, Mom Block, Equitable Giving Circle, and a few other community organizations. I'm a PPS graduate. I'm a community.
Excuse me, I don't think your mic is on.
Is the green?
Mm-hmm.
Can you hear me now? Let's start over.
Thank you.
My name is AJ McCrary. I'm speaking on behalf of Romy Ross, Equitable Giving Circle, and Mom Block. I'm a community leader. I'm a PPS graduate. I am a mom of a 15-year-old who I pulled out of PPS because this district did not treat him well as a Black child. I am extremely worried about our choice as community leaders to be opening back up. We are not considering or thinking about the children or parents of this community. The high school kids going back to school makes sense. They can be vaccinated, they can wear masks, they can understand to wash their hands, to social distance, they can follow directions. Having children who cannot be vaccinated in close proximity to each other without We all know PPS buildings are not safe, do not have good ventilation, do not have windows that open, do not have water fountains at work, a whole bunch of other issues, including rodent messes and what have you. This is irresponsible and dangerous. One child dying or getting infected by COVID is on y'all. Do you want that? I don't. I care about people that are on this board. I care about people that are in this community. We need to do better. I've been unschooling my child for 5 years as a single parent who works in the community and does a whole bunch of work, has like 4 jobs. We can do better, think better, and be innovative and come up with better solutions that prioritize our children, our teachers, and our community as a whole. I am asking and demanding that this board get more creative, be innovative, and truly do right by our community because, again, one child dying, one child getting sick is irresponsible and completely unacceptable. We expect better as community members, and we can do better as community leaders. Thank you for this time.
Thank you.
Thank you. Is Kelly McDowell here? That concludes public comment.
Thank you. Thank you all for your comments. I really appreciate your personal stories that you brought, and your comments do help us and improve our work. I know it's easier for some people to get up here and testify, and it's more difficult for others. So thank you for showing up. If you have, feel free to connect with our board manager, Roseanne Powell, if you have something specifically you'd like to follow up with the board or the board office. We're going to move to the student representatives report. Student Representative Weinberg, would you please provide your report?
Thank you to everyone who testified, especially students. Thank you for sharing your personal stories. I know it's very hard to come up here in front of everyone and then to be broadcasted for everyone to see, to share your own personal stories. So thank you. I'll actually be reaching out to you. I have a couple questions on how we can do better for this next school year. Coming out of COVID-19 is really the reason why I wanted, for my term up here, to be focused on mental health. As we come out of this pandemic, I know a lot of students have struggled with anxiety, depression, and everything that comes along with dealing with a pandemic at such a young age. So I look forward to talking with you more and other students about how we can do better. As we look to the new school year, I asked the DSC on what we're looking forward to and also what we're not looking forward to. Some of the highlights of what we're looking forward to is having hands-on activities. The Benson's rep definitely mentioned how much their CTE learning was lost during distance learning and how much he will enjoy being back in person, being able to do the things he loves. A common theme was also being able to socialize with other students. I think a lot of us missed out on that social aspect, only being able to connect with a small group of our closest friends and losing out on our wider network of support that we have from our school communities. Another student was confident in PPS admin, keeping students safe, and I do think that is definitely a positive. Some things we are unsure about is, of course, the unsure element of returning back to in-person. How long are we going to stay in person? Are we going to be able to finish this year in person? I know that's definitely on my mind as a graduating senior. Are we going to be able to have our graduation activities this school year? And of course, our New Year jitters. Going back to school is always exciting, scary, especially for our students going into high school, middle school, elementary school for the first time, but with the fun twist of COVID. So we're all gonna have to be masked, social distance. So that's definitely a damper on our excitedness for the coming school year. Also, another worry is around the transparency about what is going on within our district and about plans for what school will look like. I know a lot of students, parents, teachers, administrators are still unsure about what the school year will look like, and I hope when we do reopen that we have that all cleared out. Thank you.
Thank you, Student Representative Weinberg. Superintendent, would you like to provide your report?
Superintendent, if I may, Jackson, I just want to
ask you to please continue to let the board know how we can support you in your work with the DSC, and particularly in your focuses here on student mental health. We're here for you.
Thank you, Chair, and good evening, directors, and buenas tardes to community members and staff who are joining us here in person, and to everyone live streaming from home this evening. Jackson and I have already had some good conversations around some of his goals for this school year, and I was sharing with him briefly earlier how we're going to make some progress in a couple of those areas. So stay tuned. I'll let him share those announcements with you. Well, this is our first regular meeting of the board since the return of much of our central office staff to our various buildings around the city, which explains why many senior staff are here in attendance in person. It's nice to see folks again. We began cheerfully welcoming back colleagues last Monday morning, especially those who work in offices all around the city. We're continuing to model and practice health and safety protocols, including masking throughout the day. But really what I want to say to folks is I just want to share the appreciation, and I've been sharing this with every employee group that I've been in front of the last couple weeks, to all of our staff, those who have worked in particularly nonstop and in person throughout the pandemic for the last 18 months. Those whose specific work has allowed us to open for hybrid last spring, those who work throughout the summer in order to support and make possible a safe reopening of schools next week. Thank you. Thank you for your commitment and dedication to our students and our school communities. And I want to highlight one of those many talented staff members and district leaders and recognize her recent promotion. I'm very pleased to announce Dr. Lorna Fast Buffalo Horse, who will move into the role of Area Senior Director in the Office of School Performance. Lorna has been a director on this team, OSP, in multiple pathways to graduation since 2019, and we're really pleased to elevate her to this new expanded role. Lorna will be working with Regional Superintendent Margaret Calvert and support focus option middle and high schools, as well as multiple pathways to graduation programs. A little bit about Lorna. Before joining OSP, she served 16 years as a high school principal, including her final 7 at Alliance High School. Under her watch, Alliance was twice named one of the top 50 high schools in Oregon. She has also served 7 years as a charter school director and principal, and 2 years as the principal of SEIS Bilingual High School on the Roosevelt campus. Lorna has consistently gravitated towards schools and programs that support students who have dropped out of school or at risk of doing so, and has, along with her staff, raised achievement and graduation rates for our students. Prior to becoming a principal, Lorna served in PPS as a dean of students and multicultural coordinator, and as an ESL bilingual, migrant education, and Indian educator coordinator for a district in Washington State. She's been a teacher of adult basic education, GED classes, ESL across all the grade levels, social studies, Spanish, and credit recovery in PPS, as well as in Shelton School District. She's worked in treatment centers and at 2 community colleges. All to say is Lorna has a really broad and extensive experience. She's also taught for Northwest Indian College and in the graduate schools of education at Portland State University and Lewis and Clark College. And we're so privileged to have her here this evening, as is customary. Would love to invite Dr. Fast Buffalo Horse to share a few words with the board.
Thank you, Superintendent Guerrero, and good evening to all of the board members and to everybody here. I'm just really honored to be able to continue my work with PPS and to expand it a little bit. In the most recent position I've had, I got to work with district-wide multiple pathways programs, and I'm very lucky that I still get to work with those and have added a couple more, as well as our focus option middle and high schools, Da Vinci, Benson, and Jefferson. And so it's just a real honor to be here. I've been in this seat before arguing for a charter renewal. I've been here arguing or pleading for the multiple pathways building, and I've seen all of those come to fruition or coming to fruition. And so it's just nice to be back and to see you all and work in partnership with you. So thank you.
Many congratulations.
Thank you.
Thank you, Lorna, and congratulations. As you know, directors, preparations for this fall have been unlike a typical year. Our team will continue to have a detailed back-to-school update in just a little bit on the agenda, our main entree. So what I'll say at the moment is, in addition to all our health and safety strategies being implemented, this first day of school will be markedly different for at least two of our school communities. Because students and staff will enter the doors of the beautifully modernized McDaniel High School and the new state-of-the-art Kellogg Middle School. As directors know, we typically let our students and staff get to preview and experience their new buildings before we show off the final version to the community in a grand opening. We'll expect lots of media coverage and videos from our own team to showcase the exciting opening of these new educational buildings in Portland. We hope the whole community can join us this Saturday, August 28th at 10 a.m. for the grand opening at Kellogg Middle School, and again at McDaniel High School's grand opening on September 18th at 11 a.m. But wait, there's more. Other school campus building projects have also continued in earnest. Here in North Portland, we're in the final stages of work on the Phase 4 Roosevelt building. Downtown, work continues on the new Lincoln High School campus, and we're making progress on a brand new CTE building at the Marshall campus for Benson Tech students. So once again, thank you to Portland voters for making all of these projects possible. And now time for another vaccine public service announcement. I want to personally remind everyone in our community that it is crucially important to get vaccinated. Important for you, important for those who cannot get vaccinated, important to our ability to open and operate our schools, minimize disruptions to learning for students, and ultimately, hopefully, our ability to finally put this pandemic as much as possible behind us. As we've done throughout the summer, we continue to host a number of vaccination clinics leading up to the start of the school year. I was out at Jefferson High School for today's clinic. These are no cost, no appointment, no wait opportunities to receive a safe and effective vaccine. Thank you to our many partners. The photos you see are from my visit to Franklin High School last week, where Portland Fire and Rescue was our vaccination clinic partner. And today at Jefferson, we had Providence Health as well as MESD nurses who spent most of the day at the school. So many thanks to them for their partnership. So once again, if you're eligible, we implore you, please get vaccinated. I'm going to just close with a snapshot here. There's been many opportunities to engage with and speak to a very interested media here. It's been a busy couple of weeks since our last meeting. One of the things that was important to me when I began at Portland Public Schools was for us as a school system to be seen as leaders. We're the largest school system in the state, a member district in a league of the largest urban school systems in the U.S. Our actions should demonstrate leadership, and often that means tough decisions, but we should lead, and especially when it comes to the well-being of our students and school communities. Our vaccine mandate announcement last week, I think, was an example of our actions leading to broader actions that will help more students, schools, and communities. We don't have all the answers, but our unique perspective can often be an encouragement to many others. As I've shared in various employee gatherings in the last couple of weeks, whether it's welcoming new teachers or welcoming back our principals, I'm grateful, unlike maybe in other places, for never having to question our school boards and our broader community's commitment to taking every action necessary to protect our students, staff, and community, for not wavering on a racial equity agenda, for agreeing that we should make the most thoughtful, even if difficult, decisions that we can make. I do not take for granted, because I hear contrasting stories from my colleagues elsewhere in the state and across the country, the board's support, our staff's and community's consensus, and our playing this brand of leadership and role as a school system. So I just want to express for this, I am grateful. And that concludes my remarks for this evening. Thank you.
Thank you, Superintendent. Normally we would hear committee and conference reports at this point in the evening. I know that board members are working with staff to finalize committee schedules for the year, but I thought I would make an announcement about who's chairing which committees. The audit committee will be chaired by Director Constam, and board members Board Directors Scott and Hollins will be committee members. The Charter and Alternative Programs Director Green will be chairing that committee with Director Lowry attending. The Intergovernmental will be chaired by Director Lowry. Director Hollins and Director Green will be on that committee. I've got a typo here. The Policy Committee will be chaired by Director Brim Edwards and attended by Directors Lowry, Green, and myself. Facilities and Operations, which is formerly the School Improvement Bond Committee, thank you to Director Scott for that suggestion to rename, will be chaired by Director Hollins, attended by Director Constam and Director Brim Edwards. There's an elections task force this year that will be led by Vice Chair Scott. Directors Holland and Director Brim Edwards will also be attending that task force. And finally, the Southeast Guiding Coalition liaisons are Directors Lowry, Brim Edwards, and myself will be liaising to that Guiding Coalition. We're now going to hear comments from the Portland Association of Teachers President Elizabeth Teal. The agreement between PAT and Portland Public Schools allows for the association to be provided time on the agenda of regular board meeting for brief comment. There is no time limit. You know that, but I think you'd mentioned 3 minutes earlier. You don't have a time limit. Tonight we have PAT President Elizabeth Teal here to provide brief comments.
Thank you, Board Director, Chair DePass, and all Board Directors and Superintendent Guerrero. There's nothing that we all want more than a safe return to in-person instruction. We've been waiting for it and planning for it for such a long time. And for the students we teach and their families and all of our educators, we have to get it right. And we have to get it right for the conditions that we are in now. Despite the best laid plans and all of our hopes and expectations for this fall, the Delta variant has changed the rules. And that makes the safety agreements that we worked so hard collectively last year even more important, along with updates to account for new recommendations and new regulations from the states. I'm here to let you know that as of today, the week that educators are starting work, we still don't have agreements on what we can count on this fall for safety. And it gives me a lot of dismay to be telling you this today, but I want to bring it to the table in hopes that we can come to solutions that make sense for everybody. PAT members still overwhelmingly support the previously agreed on safety standards from last year, including universal mask wearing, strong programs for COVID testing and contact tracing, adequate ventilation, and which are, I think we're in agreement, those things will still be in place. And as well as we've partnered on moving forward a vaccine mandate for staff. We want to do everything that we can to make our schools safe, stable, and equitable moving forward this year. We're so glad that those things are in place. However, we still need assurance on some key commitments that relate to the reality that we're in right now. We know the CDC recommends at least 3 feet of physical distancing per student. And we know that PPS has committed to families to providing that whenever possible. We believe that we can meet this need for all of our families, not just when it's already possible, but making sure that we can problem solve those last remaining places so every student in every school in every classroom has this basic safety assurance in place. We know that our students in grades kindergarten through 6th grade are not vaccinated. Maybe a few 6th graders, but almost none of them are vaccinated. And we know that families, like you've heard tonight, are struggling with their options and how to keep their kids safe and their family members safe. We're asking PPS to ask families what they want, all of our families, and make sure that there is an online option for students who want it. And going along with that, we know we have educators who have medical reasons why they cannot be vaccinated, or who care for family members who are medically vulnerable. We need to provide virtual positions to these educators so they don't lose their jobs because of this pandemic. We believe these solutions work together to meet the needs of the moment, the needs of educators, the needs of families, and the needs of students.
We think these are logical steps towards ensuring the safety and stability and equity this year for all of our students and staff. We know that there are so many unanswered questions. The virus keeps throwing new things at us, and no matter how fast we work, it's going to keep challenging us to find solutions and to be creative and work together. And that is why it is all the more important that the things that we can control and put in place, we do so on the front end. We have one chance to get this right, reopening schools this year. And we have to do everything in our power, including taking the time to do it. District leaders must have the courage to join together with teachers and families to do whatever it takes to ensure the safety, stability, and equity for all of our students in this new school year. We owe it to our communities to do everything we can on the front end to keep them safe. We don't want to have a year full of disruption. We know that there are problems and that we see them across the country with students being quarantined. We have solutions we can put in place now, and I believe that we can make this happen. But I do want to tell you, there is an enormous amount of stress out there not having these agreements in place as schools are opening now. I mean, for educators and for students next week. So thank you for taking the time to listen to these comments tonight and for helping move forward together for assurance for all of our educators, students, and families.
Thank you. Thank you. So we're going to get a back to school update. Superintendent, would you like to introduce this next item?
Yes, thank you, Chair. Again, we have three of our senior staff here for directors to present a back to school update. So you'll hear from our deputy superintendent, our chief operating officer, and our chief of staff. And they're going to run through some slides, and they're prepared for all the predicted questions. We know that you will want time to ask, and we know that our community has them as well, and hopefully many of them are posting them to our Let's Talk system to include in our FAQs. But without further ado, let me turn it over to staff who can introduce themselves.
Thank you, Superintendent Guerrero. Good evening, directors and Student Representative Weinberg. Tonight, my colleagues and I will be providing you with an update a week before the start of school on September 1st. As the superintendent mentioned, I'm joined by our Chief Operating Officer, Dan Young, and our Deputy Superintendent for Instruction and School Communities, Dr. Sean Bird. Directors, we hope to go over this presentation first and welcome questions or comments at the end. Directors, we are excited to see our students, families, educators, community partners on the first day on September 1st. As I shared last week, Multnomah County Public Health Director Jessica Grinswy and other public health officials here and across the nation have shared that one of their top public health priorities is getting kids back and keeping kids in school this year. This, of course, follows the directive from you, the PPS Board of Education, which unanimously approved Resolution 6316 to allow for a return to full-time, 5 days a week in-person instruction, while also mitigating the spread of COVID-19 and creating an online option for those families and students who are unwilling or unable to return on-person learning. And so for tonight, you will hear 4 specific details as we welcome students for the first day of school next week. First, as our community has seen firsthand, public health guidance and rules are evolving each and every day. Both our academic and operational teams are literally, and I'm not using that word figuratively, been working around the clock to evolve, create, and respond to the shifting guidance. We want to share with you tonight a few important updates that we'll share with our community in a comprehensive update early next week. Next, we will share with you our preliminary student enrollment for the 21-22 school year. As Dr. Bird will note, we are seeing low numbers for students in kindergarten, but we're also welcoming students each and every day. Third, we will also share with you a snapshot of our staffing journey for this upcoming school year. With school beginning in 8 days, our hiring teams are also, with steadfast determination, working to welcome new colleagues at PPS. And lastly, we wanted to share with you an update on our online learning academy, including sharing with you the latest numbers of students enrolled in the program. As we've been sharing with families in the broader community, PPS continues to follow local and national public health guidance and will implement layered health and safety measures across our schools. We believe, informed by public health experts, that establishing these strong layered health and safety measures against COVID-19 will help maximize uninterrupted in-person learning experience for students. Here at PPS, we recognize that no single intervention is perfect at preventing the spread of coronavirus. In consultation with public health experts, we've identified at least 9 effective health and safety measures to keep students and staff healthy and safe as possible against COVID-19. Of course, some of the public health guidelines has shifted, while much more detailed planning has gone into some of these areas that we wanted to make sure you heard it from us here. I'm going to turn it over to Dr. Bird to walk us through some of the changes, who will also share the mic with Dan Young.
Thank you, Jonathan. Good evening, directors and Student Representative Weinberg. As we all know, vaccinations against COVID-19 are the most important layer of protection against COVID-19. Across our communities and in hospitals across our region, we are seeing the impact of COVID-19 cases among the unvaccinated. That is why, as you know, Governor Kate Brown announced a day after we did that all staff, volunteer, and contractors will be required to be vaccinated against the coronavirus. Yesterday, we communicated next steps with PPS staff on how they will need to submit proof of vaccination. As of today at 5 p.m., in about 24 hours, we've received responses from close to 2,500 of our staff members, with over 95% of those affirming that they have been vaccinated against COVID-19. For our students and broader community, we're doing our part by hosting free COVID-19 vaccine clinics across our schools, as our superintendent mentioned earlier. This week and into next, students and anyone who still needs to get vaccinated can visit one of our comprehensive high schools to receive their shot. On the screen there, you see the dates of the upcoming vaccination clinics, and we hope you will continue to promote via your social media accounts these opportunities for our communities. Another effective health strategy we've discussed is the usage of masks. Earlier today, Governor Brown announced an outdoor mask mandate, and in less than an hour, we shared with our school principals that all adults and students will be required to wear masks at all times, regardless of vaccination status, whether people are indoors or outdoors. This is particularly important for children who are outdoors for recess. Of course, there are exceptions to this rule, including when individuals are eating, drinking, or, of course, playing a musical instrument that requires the use of their mouth. We currently have 1.8 million masks, age-appropriate masks in our warehouse, which are available to all PPS schools and are being delivered regularly. And since this new rule today, we are waiting to hear from the Oregon School Activities Association, or the OSAA, and the Oregon Health Authority about what this means for student athletes in competition. We do know, however, based on the information shared publicly today, that schools will be subject to the rule when holding outside public events, spectator events, and gatherings of the general public on school grounds. We've already made the decision that masks will be required for competitive indoor sports in the fall. I'm now going to turn it over to Dan Young, Chief Operating Officer, who will give you an update on our efforts regarding physical distancing.
Thank you, Dr. Bird, and good evening, directors. As we shared with you last week, our operations team, in close partnership with school principals and area senior directors, are actively evaluating each PPS classroom across the district. As of today, I can report that based on current enrollment and schedule information, about 97% of our middle schools and high school classrooms can accommodate a minimum of 3 feet of spacing prior to any specific intervention. Our effort, of course, is in accordance with RSSL, which clearly states that school districts should create and support physical distancing in all daily activities and instruction, maintaining at least 3 feet between students to the extent possible, and maintaining physical distancing should not preclude return to full-time in-person instruction for all students. We plan to apply additional configuration changes to get us close to the 3-foot distancing requirement, including measures like removing ancillary furniture from classrooms, rearranging desks, or changing desk types, moving or switching larger classes with smaller class sizes, and or repurposing traditional non-classroom spaces to use as classrooms. We are finalizing our space analysis for each PPS elementary school classroom and plan to have this completed by tomorrow. Lastly, we understand that the to the extent possible caveat of the 3-foot guidance raises questions about how often there would be less than 3 foot allocated to each person in the classroom. There are some immovable constraints of space and students that require us to find different solutions. We cannot expand our classroom spaces through rebuilding them, and we cannot limit the number of students we serve. We must follow RSSL guidelines to offer full-time in-person school for all of our students, and we take our public health authority's direction that the public health priority for our children is in-person school. We continue to view each layer of safety as working in conjunction with all others, while we focus on strengthening each layer to continue to find solutions to the multitude of challenges for each. None is perfect. The strength of our health and safety plan is ensuring that each layer is at its maximum capability. For physical distancing, we have very few, to the extent possible, exception classrooms, and we are working through each one of those without compromising our mandate to offer full-time instruction to every student. Last week we shared with you directors our PPS communicable disease monitoring protocol outlining the steps we will take to monitor infectious disease and illness in schools. We know you have this in your inbox, but we also want to provide you with a physical copy here tonight. As you can see, this protocol was developed in close collaboration with Multnomah County Health Department and the MESD School Health Services, two critical partners who will conduct contact tracing and help monitor and minimize the spread of COVID-19. As we shared at the last board meeting, we are meeting with and developing the necessary protocols to offer COVID-19 testing for students and staff. Right now, our staff is working on providing 3 different options for COVID testing and screening. One, as mentioned before, all staff will be required to be vaccinated, and for those who cannot be vaccinated, we will provide screening testing on a regular basis. 2, for all staff and students while on school premises, we will have symptomatic testing available for those showing signs of COVID-related symptoms. And we will, of course, follow all safety protocols in regards to isolation and quarantine per Multnomah County Public Health. And 3, for students, we will provide screening testing. We're still working with the health officials to determine criteria for screening, consent forms from parents, et cetera, and we'll have more to share very soon. One of the most important questions from family has been, how will mealtime work? It's important to note that mealtime are one of the most challenging times of the day to maintain health and safety measures as students congregate to eat, both here in Portland and across every school building in America. Based on recent discussions with our public health partners, we have asked schools to prioritize eating outside as much as possible and anticipate eating outside the majority of the time during the first 6 weeks of the school year, if not more. Of course, in Portland, outdoor eating is not always an option due to a variety of reasons. Therefore, each school will develop a unique meal service safety plan that will be put in place when outside eating is not achievable. Each school's unique enrollment, facility capacity and constraints, staffing and schedule, et cetera, vary. And as a result, PPS will have 81 different meal service plans, but each plan will have the same aim, including maximizing distancing to as much as 6 feet where possible, limiting the time the students are unmasked eating to less than 15 minutes, and utilizing a student seating chart or sitting in cohorts when available. And before I turn it back over to Jonathan, I want to share with you directors that our Safe Return to In-Person Instruction and Continuity of Services plan, which describes our layered mitigation strategies, is posted online for public view and comment, and we encourage our community to share their thoughts. We will submit this plan for review to the Oregon Department of Education before the due date of August 27th.
Thank you, Dan. Since our last board meeting, we've averaged just about 1 email communication to all families every day, letting them know about the latest updates and sharing with them answers to common questions related to back to school. We also recognize that with so many of us receiving so much information in our inbox and through many channels, that it's important that we share with families a comprehensive back-to-school communication that outlines all they need to know for the first day of school. Our plan is to have that shared with families in all 6 supported languages by next Monday, August 30th. This, of course, comes in addition to our back-to-school website, pps.net/back-to-school2021, where families can find the latest standard operating procedures and answers to commonly asked questions. And speaking of commonly asked questions and answers, as directors know, we've been getting questions, feedback, and concerns via our Let's Talk platform, which has allowed us to focus on the most sought-out information from parents in our FAQs. We plan to update the FAQs and share an update via email to families by the end of the day this Friday.
All right, we also wanted to share with you a preliminary student enrollment information that we are closely monitoring ahead of the first day of school. As you can see, as of yesterday's enrollment data, we are seeing a 3.1% decrease in enrollment from last year, with the biggest decrease in kindergarten, currently seeing a slight, sitting at a change of about 15%. Of course, kindergarten enrollment often happens late August and early September, so we are expecting those numbers to change every day. And for those families who are listening in today who have kindergarten-age children who are not yet enrolled, we're excited to welcome you to PPS. Please visit your neighborhood school or contact our early education department to learn how you can enroll your child. We're also proud to share with you that as of today, we have identified 100% of our school principals to lead our schools for the upcoming year. Those announcements, as you have seen in your inboxes over the last few days, have been updated. We're also excited for the new talent joining our school district and encouraged by so many of our seasoned professional administrators coming back to serve in interim positions. As many of you know, about a dozen school principals were promoted to and or transitioned to central office positions, including some who will serve as mentors to school principals. While there are 400 plus substitute educators ready to take jobs today, we're working with over 250 substitute educators to complete their requirements to renew their substitute roles in the district. And as of yesterday, we had 190 classroom vacancies. However, our hiring and talent team are aggressively working with candidates each day, with them being at different stages in the hiring process. So many of those people are in process to be onboarded to the district. As we've also shared before, we have a little over 350 custodial positions across our district. And as of yesterday, we are down to 40 vacant positions. And again, as you can imagine, our HR team is working closely with Dan and his team to fill those gaps. Before we turn it over to questions and comments, I want to share an update on enrollment to date and clarify a few misconceptions about our online learning academy. As of today, 513 students are enrolled in the online learning academy with about 152 on the wait list. On the screen behind you is the current enrollment and wait list as of today at 5 p.m. These numbers are dynamic and in flux. While we did, in fact, have a priority deadline earlier this summer, registration for the Online Learning Academy has never closed and continues to remain open. We've been monitoring the wait list, and we have repeatedly been able to clear the wait list by allocating additional staff and adding virtual classrooms. In addition, some people who accept or who are offered a spot decline that spot, so then we go to the wait list and clear those people from the wait list. That's another way that we are able to clear it. Students are prioritized based on medical need and their high-risk status. There have been questions raised about the district's offer of online academy programs and whether families were aware that they had an online option. The district focused its outreach on a survey to the 15,000 families who stayed in comprehensive distance learning last spring and made personal phone calls to over 1,000 of these families. We worked with school-based counselors to identify students for specific outreach, worked to prioritize students served by our racial equity and social justice partners like SEI, Latino Network, and ERCO, and students who remained in distance learning for the entire school year. All PPS families were informed through a number of electronic communications this summer. We also want to be realistic and upfront with our community. There are constraints on the number of students we can enroll in the Online Learning Academy. This is not a new issue. Every specialized program here in our district has enrollment constraints. Every district in the United States is facing the same issue. It is simply not feasible to offer unlimited enrollment. However, we continue to work our way through the wait list and continue to have families add their students to the wait list every day. You have this commitment from us. We will continue to work directly with every PPS family and student to ensure they have all the resources and information they need as we welcome students back on September 1st. And just some additional information for you about the Online Learning Academy. We can send to you a breakdown of the enrollment by race if that is of interest to you. With that, I look forward to your comments and questions.
Thank you. Do we want to just open up the floor for questions then? I have a short list of questions, but I'd offer not. I don't need to go first.
I would like to see the breakdown for Ola by backgrounds of all those students.
Sure.
And I noticed there were some things like we had 17 ninth graders and 1 on the wait list, and I'm assuming that's because that's all still in flux.
Yeah, so all students when they apply, so we have room in 6 through 12, but when they apply, they go on the wait list, but that's just so the system can perform the lottery because we do prioritize students with medical condition and SES, so they are removed. It's a technical process.
That's what I assumed, but I've learned to ask about my assumptions. So thank you, Dr. Bird.
And Director Lowry, in terms of, we'll send this via email so you have it in writing. Obviously, this data is constantly in flux, but in terms of enrollment by race, as of today, as of this data point, 16.7% of students identify as Latino or Latinx, 15.5% as multiple races, 49.9% white, 2% Native American, 9.82% Black/African American, and 7.82 Asian.
So Chief Garcia, that tracks very closely with our overall enrollment.
Yeah, that's similar to our PPS enrollment numbers, correct.
Go ahead.
Thank you. Thanks for the update. Really appreciate it. I have a specific question around lunch, and I'm sure you're getting the emails that we're all getting as well. And I really applaud the decision to do outdoor for at least 6 weeks and potentially longer. I think that's a really, it's a good way to continue to put another mitigation strategy in place. One of the things that I've heard from parents, who are getting now the specifics from their particular school, some schools are sort of going with a 6 feet distance, outside, but other schools are going with 3 feet. And I'm curious, have we provided guidance to our principals? I heard you say there are some limitations, but I'm thinking particularly in this first 6 weeks while we're outside, I would think there are fewer limitations in terms of the social distancing side of things.
Yeah, that's a great question. So when outside, the guidance is 3 foot distance. So to still maintain the 3 foot distancing. As far as the cohorting requirements, it doesn't, when you're outside, it doesn't have a distancing requirement. But in our conversations with our public health advisors, they said recommended still maintaining that 3 feet. We think that's achievable outside, so that's what the guidance is.
And our public health advisors have weighed in and said, 3 feet outside, kids unmasked should be fine.
Correct.
Great, thank you. And then another question I got was about tents, and one of the schools said that they were not going to be allowed to put up tents. So could you talk a little bit about, do we have policy around that, or what's the thinking?
So we're continuing, even tomorrow, we're having some conversations with our schools about what would be the best supports for outside lunch. And tents have some challenges. They're problematic in some ways, and they are also good only in certain circumstances. But we want to have those conversations about what do those schools need. Is it tents? Is it seating? We saw all the schools are submitting their individual plans. We saw one had a creative idea of having these plastic totes where their younger kids could sit on, those sort of things. So we're having those conversations, and there's kind of two parts. We want to make sure that we're able to support the outdoor lunches, but we also want to make sure that each school has a plan for when they can't go outdoors. So when there is that situation, we want them to know that there is a seating plan for when they're inside, about creating as much spacing as they can, limiting the time that they have the masks off, et cetera.
Great, and they are Oregon kids, so they can be outside even in rain and cold. They grew up in it, so yeah. Thank you, appreciate that.
My mom used to say it's just water. Are there any other questions? Directors Holland or Green?
I have a couple questions. Do you have any questions?
Constam?
First, this is for you probably, Chief Byrd. So have you made any staffing shifts in response to what we're seeing as our enrollment numbers?
Not yet. So we have allocated additional staff to schools where they're over the threshold. We have, are you asking about kindergarten specifically because the numbers are low? We have not taken any staff because we do anticipate those numbers are gonna come up as they do every year.
They're finding their way back.
Yeah.
And then I just had a statement really for my colleagues looking at those enrollment numbers. Like, I personally believe that we need to look at high school enrollment balancing sooner rather than later. It's been a festering issue for a long time. And now when we look at these numbers, I think it's getting indefensible. Jackson just said Cleveland's at 1720 this year. What's Franklin? It's like
Franklin
25.
is 2151 and Grant is 2200.
Yeah. So this is an issue that no board ever wants to tackle. But I don't think there's a way that we can defensively avoid that this year, and particularly when you look at the bulge in 9th grade. So we can probably expect that trend to continue. And I think the good news there is, and this is just my assumption, but I think we're seeing a lot of families returning to our beautifully modernized buildings. We're attracting a lot of families who have not been in our system prior to high school. So that's a good thing, but I think we can reasonably expect to see it to continue. So I support tackling that really hard, controversial work this year.
Sure. Just do just a little balancing exercise. Do you have questions, Director Holland? Holland, do you want to go ahead?
Yes, thank you, Madam Chair. So I have a few questions. You talked about the constraints for Online Learning Academy. What are those constraints as far as if we can increase those? What are those constraints?
Right. So we have been able to, as I said, clear the wait list. The constraints really are at a certain point we have to open schools. So people need to make a choice and they need to remain there. And so we have 4 vacancies right now in that program that we're continuing to fill. That's to serve the students that are already there. So right now what we're doing is we're holding on the wait list for a minute that we have. There's 152 people on there. We're holding on that. We're going to fill those positions. We have to get teachers trained because it's a different platform that they use. It's not the same as comprehensive distance learning. It's an entirely different platform. That takes some ramp up time. And then we know that from many people in the community have talked to us about as soon as their child is able to get a vaccine, they're going to want to return to their neighborhood school. And so we can't just shift the staffing, overnight. That takes time to do. So we have to be mindful of those constraints because, as we continue to move through the semester. So we are able to, by prioritizing those students with health needs, we were able to get them on in the online program. And we're continuing to look at that wait list and evaluate that. About of the offers we've made, 92 people have then decided not to do it. So we've been able to clear the wait list that way too. So we know that some people are continuing to evaluate their decision and decide whether they want to stay in the neighborhood school or go back. So it's really about the logistics of it and making sure that we can staff both schools. And as you heard, we also have teacher vacancies that we're still filling. So there's, as we all know across the country, there's a labor shortage in every industry. So we do have to at some point be prepared to open school with.
Okay, so just to make sure I'm clear, so basically we're saying either they have to if they make the choice of doing online learning, they should anticipate having their kids in online learning for the year.
At least a semester.
At least for the semester, okay.
Mm-hmm.
And you talked about the vacancies, and I'm new at this, so
Sure.
Is it normal to have this many vacancies every year?
Yeah, so a lot of those are actually in process. We're not interviewing for 190 positions. A lot of those people are at some point in the process. So you have to do your background check, your licensure. That takes some time. Sometimes there's a backlog in the state right now with TSPC. So it is, it is. And principals just returned to work a couple of weeks ago, so we had a lot. It was a big number, and then it went down really quickly. So we anticipate those will continue to clear, and we'll be ready to open school. We also have our substitute educators that we're ready to fill in for in the instance that we wouldn't have somebody ready for the classroom for day one. But our goal is to get the teachers ready for day one.
What's the denominator on that? 190 out of how many?
For teachers,
Yeah.
4,000? 40,000, 4,500.
Okay, I just wanted to put it in context.
And Director Hollins, if I may, on August 1st, we had 350 vacancies in classrooms. And so kind of just gives you a sense of, from August 1st to now, the work that the team has done to bring folks on. So this is a pretty natural thing that we see across school districts in America, really wanting to make sure, in the last few weeks is when we start to see an influx.
Okay, and that's what I was asking, because I was looking at that 350 number, and it just seems pretty high, so I didn't know if that's a normal thing for school districts, or is that like a retention problem? I was just trying to figure out what that was. The other thing as far as, are we going to be listing all 81 school meal plans? And when do we expect those plans to be posted?
They're all going to be submitted by end of day Thursday. We'll have a chance to review them so they get approved by both our nutrition services staff and the area senior directors, and then we should be able to post them next week.
What day next week?
I don't know. Early next week, I think. We'll have a specific date, but I can get back to you with specifics.
Okay.
But Dan, will that be posted before school starts?
We'll do it by the end of day Tuesday.
And just to clarify, those plans are for when we can't eat outdoors. That's the alternate plan, yeah.
Plan B.
Yeah, Plan B.
Are you finished, Dr.
Nope.
Hollins?
Got a couple more. So do we have I'm getting a lot of questions as far as the whole matrix, if we shut down piece. Is that a school district decision, or is that a governor decision if whatever numbers we get to, if they shut down the schools again?
I just want to make sure I understand your question. So your question is, who would mandate the closure of schools in the event that COVID, there's a
Right,
high-
yeah, right. If we, no, just talking about
The entire
Portland
district.
Public, right, for Portland Public, is that, if we get to a certain number, is that a school district decision, or is that the governor's decision? I'm just,
Well, certainly there could be a decision at the state level that mandates a delay, a closure. We've seen it in this past 18 months that that's happened actually on a regular basis. If the question is about when we see single cases or clusters of cases, at what point is the quarantine number high enough to have us consider closing a school temporarily, for instance? I think that's what you're asking.
Mhm.
That would largely depend on the recommendation from our local public health officials about, are we reaching a threshold where it makes sense to not just close down the cohort of the classroom or even the classroom wing, but maybe the whole school community? We would be working very closely with our public health officials to make that kind of a decision.
and do we have those, have we talked with them about what those metrics might be? If, so for instance, if a class,
Director Hollins, yes, so we have been in communications with with Multnomah County Public Health. As you know, when the pandemic started and has evolved, the state released some metrics, right, some thresholds when school districts would move from hybrid to CDL to in-person, et cetera. The governor and the state of Oregon removed those thresholds early in the summer. And so in the last few weeks, we have expressed an interest in learning and knowing what public health's recommendations would be in the chance that public health would decide that, you know, having enough people in a space is deemed harmful. So working with public health officials to get that threshold and those measures are going to be really important. You know, we want to make sure that we're listening to the public health and having them make the determination. So similar to our isolation and quarantine protocol, which were developed with Multnomah County and MESD's health department, they're the ones that really govern or manage and share with us the steps that we need to do to quarantine or isolate students or staff.
okay, so we do or don't have that threshold yet?
So there are no thresholds right now per the state of Oregon.
If there are going to be some, will we be how will we let the community know what those thresholds are once those thresholds are figured out?
Yeah, we would use all channels of communication, so email communication, social media, et cetera, if we do get to that point. But again, I would say that as of today, the governor or the state of Oregon has not released any thresholds that would determine whether school districts would move from one version of learning to another.
Thank you guys so much. And I know you guys are doing great work, and it's a lot of work, so I really appreciate what you guys are doing. Thank you.
Just an additional note to Director Holland's question around our newest educators. Many of us were there present. Thank you, Director DePass and Director Constant, for saying some welcoming remarks to them the other day, along with PAT's president. In an informal survey of the crowd, you know, how many of you are new to PPS but come with a teaching experience? A pretty significant percentage of the people raised their hands. So not only are we welcoming people new to the profession, but increasingly it appears people are choosing PPS as their employer of choice. So we want to welcome those folks from wherever they're coming from to the family as well.
I know that Director Brum Edwards is on the phone and has several questions. Would you like to go ahead, Director Brum Edwards?
Excuse me, just a second. I've got a connector in via my computer. Are you ready, Director Edwards? Yes.
Should I go ahead?
Yes, please.
Thank you. First of all, I want to thank the staff for all the work that's gone into the preparation over the last month, and also to the communications team for pushing out a lot of information. And I think several of my questions were answered and asked by Director Hollins. I just want to clarify a couple things. I know that we have posted online the plan that we plan to submit. Can somebody, and I don't know if this is Chief Byrd, share one, how people provide feedback, and then second, or how community members might provide feedback on our plan, and then second, does it need to be approved or we just submit it?
That's a great question. So the plan is on our website right now. It's actually right on our main page. When you click on it, it gives you an option to provide feedback through Let's Talk, and then Let's Talk has its own button to say, this is what my feedback is for. It's for the specific plan. So that's the route that we're getting the feedback. I have seen some people have been emailing me directly, so that will be included as well. And my understanding is that the plan is submitted to the state. They do not specifically respond with an approval. They take it in as information.
So the requirement is that we provide a mechanism for feedback, and I guess the question is, what sort of feedback have we received to date, and are we making any changes based on that, or are we moving ahead with the plan that we have posted right now?
Yeah, we certainly will make changes based upon the feedback. I don't have a good summary of what that has been to date, but we can take a look at that and provide that information. But we will review everything that we get. We will make changes to the plan as necessary. And I'll also, I suppose, point out that the substance of the plan is really our health and safety measures that have been in place for a while. They've been available for a while. So we've already gotten some feedback on those, and those have been incorporated into the plan and how we've made changes so far. But anything new that comes in over the next couple of days, we will look to incorporate into the plan.
And then how will there be a presentation or something shared with parents of anything that, say, we have a snapshot of where we are today, and then between now and the first day of school, what's new, what's changed? I mean, for example, what I thought I heard earlier is some of the meal plans or how we're going to structure lunches aren't going to be ready till the end of the day Tuesday, which is the day before school starts. So where is it that parents are going to be able to find the most current, up-to-date information before that first day of school?
Thank you for your question, Director Edwards. Is this on? To answer your direct question, on Monday, next Monday, we will be releasing comprehensive communication that includes all of the latest health and safety measures. As we know, things are shifting every day, and so we're really anticipating that on Monday we will share that with all families, like a one-stop email communication, if you will. In addition, we also have our back to school website, so pps.net/back-to-school 2021. That also has much of that information as well.
Great. I'm sorry, I have two more questions and then just a comment. I'll start with my comment. One, I want to thank the staff. Today, I received a communication yesterday from a representative with All Born In about the concern that many families with medically fragile or immune compromised students may not have chosen the online option because we weren't in the middle of the Delta variant surge, and that things have changed. People are interested in that. So I want to thank Brenda Martinick and Chief Byrd for willingness to have a conversation. I know that those families were contacted at the earlier stages. I just think we're in a different point in time right now with the Delta variant. So thanks to staff for their willingness to have that conversation. Then the second is around testing. And so I'm not sure I wrote down what was the plan for the screen testing for students, but it's not clear to me what that looks like. So first day of school, do we have some sort of random screen testing that will be implemented, or will we have some process by which by the end of the first week, all schools will have had some sort of all students will have had some sort of screen testing? What's the plan for that versus for staff?
So thank you, Director Brett Edwards. For student screen testing, there's a meeting this Friday with OHA to lay out more of the details. As you know, this program was recently rolled out, so we are learning more about the student screen testing. And in terms of staff, that is a voluntary enrollment for staff members, and they will, if they elect to enroll in that, they will receive a test kit at home that they'll mail back and they'll do that every week and get the results of that. But for student testing, we'll have more details, many more details after this Friday when we have a meeting about the testing.
So that will be wrapped into the start of the school communication that goes out at the beginning of next week.
Correct.
Yeah, and then just the last question, and this is probably a sort of more future-looking question, is if we take the 3% enrollment decline this year on top of last year's enrollment decline, while it may be a catalyst for high school enrollment balancing, I think it's a bigger call to action for, where are those 4%, 4 to 5% of the students who we've lost? Where did they go? What sort of planning do we need to do in order to bring them? I'm hoping we bring them back if they're our students, and that we continue to be able to serve them. But I'm curious about what impact they have with the numbers. If Beaverton or Salem don't have similar declines, we may not be the largest school district in Oregon with those combined 2-year declines. So I'm interested, who's on point for looking at those, what happened to those students?
Well, I think with
and how we serve them.
It's a fair question, Director Brim Edwards, because we're very concerned about monitoring our enrollment trends as well. Probably the best time to do that will be after the traditional 10-day count and the dust settles and students have landed. As we've pointed out previously, PPS, like our other metro districts in the state, most of their enrollment declines were experienced in the younger grades, generally K1, 2. We're continuing to see that number now as they start to register back. And since I have the mic, I want to encourage our families. We have available preschool seats. Sign your student up. We have available preschool seats, many of them. So we really want to get them in the pipeline early with early education. But similarly for us, it's the primary grades where we've seen the biggest decline. But we'll look forward to sharing with the board as soon as we have more concrete information, year-over-year trends. I made the same observation when I saw these numbers initially. We're seeing a drop from last fall's number, and last fall's number was already a little bit lower. So that is something we should pay attention to. I don't think it's unique to PPS, but it does beg the question, where are they?
Thank you, Superintendent Guerrero. Looking forward to having that discussion.
Thank you. Director Green, did you have questions?
Yes, I do. I have a couple of questions, and forgive me because I'm new, and I'm learning a lot of this stuff. When I was at Roosevelt, if I would take kids on a field trip, I had to fill out a field trip form, and if I took 10 kids on the field trip, I was required to bring all 10 back. I couldn't say that, I took 10, I brought back 7, so I got 70%. So why aren't we happy with the fact that I brought back the 7 versus being focused on the 3 little kids that I lost? And the problem with that was that in that scenario, we recognized that any kid lost was unacceptable, right? You can't take 10 kids on a field trip, come back with 7, and then expect to be praised because I brought back the 7. My question for us as a district, for us as a board, I know that we keep saying that we're going to listen to OHA and we're going to listen to, what the governor or different ones said. But at what point do we say no kid getting sick is acceptable for us as a school district, and say that we have to do something different? We've got a whole host of kids that cannot be vaccinated. We know that they cannot be vaccinated, and there's nothing right now that says that it's going to happen before school starts or before school ends. But yet we're not providing those families with an option that says, we know that you can at least do this, so this is what we're going to do for you, right? And so what I'm trying to understand is, I'm excited about our online program, but that doesn't meet the bill for all those families who are going to have kids that they know they're sending them to school unvaccinated. They know that the Delta variant is stronger than the previous, the Alpha variant, the one that was here before. And they know, because they're kids, that I don't care how much you tell them that, I need you to stay 3 feet apart, they're not really going to do it. And then we see people put these same kids up, the same kids, and they say, would you rather go back to school or do you want to stay at home? But we don't trust these same kids to answer the decision of, do you want to eat a healthy breakfast or would you rather have candy? So we know what's best for them, so we do it anyway. But yet in this regard, we want to try to disregard it as if, well, we want to listen to what they want. I hear you, but if my kids had their way, they would have ate candy until they were like 13. They wouldn't have had teeth, and because they would have just rotted out all of them. And so what I'm trying to understand is, why can't we as a district, again, I understand that I'm new. There's a lot of protocols and stuff that I don't know. But why can't we as a district say, we don't care what the governor says or what OHA or these different ones say? If we see that we start losing, we're on a trajectory where we have lost 2 kids in this school, 3 kids have had to go home in this school, 3. This is what we're going to do, period, whether somebody else likes it or not. And I believe that because we like to be on the cutting edge, we were on the cutting edge when we said we're going to mandate all teachers to be vaccinated. Why can't we be on the cutting edge when it comes to this regard? And then why can't we be on the cutting edge? And I know that this will probably, not everybody's going to clap for it or appreciate it. But if you're going to come to school, then, and you want to be in the school, then I need to know that you've got a vaccine. If you haven't had a vaccine, then you have to be tested, period. And it's not take away the option. That's the problem. And I'm saying that because I know it's my problem. If you tell me I have this or this, then I get to make a choice. But when they came out with that 64-pack of color crayons, I about lost my mind, because you got too many different variations of red, too many different variations of orange, too many different variations, and I literally lose my mind. I don't know what to do. But if you give me, you either do it or you don't, then I can make a choice. Why can't we as a district say that? And a lot of it, I didn't want it because Jerry said a lot. But why can't we say, if you're going to come to school, it is a requirement that you be vaccinated. Or if not, you're going to do weekly testing. If your kids are below the vaccination age, then we're going to provide you and you don't feel comfortable sending your kids back to school, as a district, we're going to reinvent and reinvest and figure out a way to do a distance learning option for you that does not take you out of the PPS school system and put you into an online option. And this is how we're going to do it. And I know that it costs money, and I know that there's a lot of money also coming down the pipeline that we can get our hands on, that we can continue to do that. And so those are my thoughts that I've been trying to put together. I didn't even go through them all. I got a bunch of notes that I've written down, but I figured I'd just stop right there as not to take up too much time.
We do want to commit to, keeping our meetings, on time this year. I know Director Scott is also a fan of that. So, but I appreciate your comments, and most of the questions I have also been asked already. I'm concerned with what we do with the kids who are between vaccinations that are getting at Benson, for instance, vaccinated on the 30th, and will have 2 weeks before they get before they're fully vaccinated. And that's not just Benson, but that's some of the other schools that are getting vaccinated this week. I'm really concerned about accommodating students that want a CDL option, that are scared, particularly for those families that are under 12. And actually, I'm going to be very frank right here. I'm scared, and I'm not scared of much. I'm really not. And I'm really, really scared. My tolerance for any disease that is preventable in this district is 0. I don't want to see a child lose their life or be sick. I really don't. I am scared. I fully have confidence in the protocols and the practices we've put in place for the Alpha variant. I felt confident that with vaccinations, but I now know about 8 people that are sick that are vaccinated, including a former director, our former director, Julia Sparza Brown, who says she followed every precaution, she was vaccinated, and she has a very bad case of COVID. That's about the 9th person I know that's gotten a breakthrough case. So I am very, very concerned that we don't have a number that we can hang on to say that, at this is our tolerance level for COVID cases in the district. When we reach 1% anywhere, we need to take precautions. And I'm just being really frank. I'm very, very concerned. This Delta variant is highly transmissible, and it is expected to peak on September 7th. And we're running out of ICU beds, and children are getting sicker, around the country. So I want to just put it on the record that I'm planning on, washing my hands, and I want to visit, see these children, the kinder, back to school. I'm really excited to see their new shoes and their backpacks and everything. But there's a big part of me that's very scared for our community, not just everybody, all of our stakeholders. I'm very, very concerned.
Chair to pass. Can I? I did want to say that, one of the things that this board did is we did pass 2 resolutions directing the superintendent not to offer CDL. And we did pass the 2 resolutions saying full 5-day in-person return. So I think, as we talk about things with Delta has changed, it may be time for this board, if we want to do that, to take responsibility and think about a resolution, because we passed that earlier. And so I think it's challenging for our staff if they've received direction from the board about how to reopen the school year and they're doing that. And then we're up here saying, we're concerned. I think we need to put our money where our mouth is then and think about if we want to change direction, then we need to give our staff some clarity on that.
Sure, and I appreciate that we made those decisions, and we made those decisions before at a time when we were dealing with a different variant. And if we're at an educational facility, our core mission is to educate kids. We also have to be a learning organization as adults, as a board, as staff. When we get new information, we have to react to it differently. It's our responsibility to take in new information and make different decisions with it. I'm sorry. Go ahead, Director Scott. And thank you for your comments, by the way, Director Lowry. I know that we have directed staff to go one way, and the information that we're taking in has changed.
Yeah. And I think my point is that it's really easy for us to make statements on the dais, but we need to, if we want to change direction, we need to make that clear to staff.
I completely understand, and yes.
So I guess I don't disagree. Delta is different, and Delta is scary, and I get the numbers, as does everybody else in the briefings. I want to make sure we circle back, though, to the other side of this equation, which is what happens to our kids when they're not in school. And I think that's what I'm afraid it got lost in last year's debate, and I'm afraid it's getting lost a little bit here tonight as well. We heard from students about, how devastating that was. We know that students nationwide lost between 4 and 7 months of learning last year, and it was our students of color that were close to the 7 months. And so I think what we're trying to do, and what the district and the superintendent have been doing, I think a really good job of, is balancing. This is very scary. COVID is scary. It was scary from the beginning. The Delta variant is scary. The learning loss of our children over the last 15 months is also scary. And our job is to balance those things. And I know that, I don't think there's any disagreement up here on the board about that. I want to make sure we're saying that in the record as well. We need to be figuring out a way that our students don't go into a third year of school with that same sort of devastating loss. And so I honestly, I feel really comfortable with the mitigation measures that are in place. We've been following the public health guidance that we've gotten that says, our public health officials or our public health advisors don't have any incentive to lie to us about what they think is safe. We've been consulting with them all along, and they say this is safe. And so that is what gives me the confidence to say, going into the school year, it's safe. I don't disagree at all that we need to be monitoring. Absolutely, we need to be monitoring. And if there are isolated outbreaks, we need to deal with those. If there are system-wide or district-wide outbreaks, then by all means, we need to have a conversation about why that's happening. I would be very nervous about making that decision now, given all the work that has gone into this. And I'm not the chair, so I might.
I would really ask the audience to please be respectful and not boo. That's really bad audience behavior. I don't appreciate it.
And if I could make a friendly suggestion,
You can
sometimes
clap,
just
but please don't boo my colleagues. Thank
jazz
you.
hands, or
Thank
maybe
you,
thumbs
Chair
down. I said jazz hands.
No, we need to act we're adults, and we need to act, we can't boo people. It's just not okay.
Thanks, Chair DePass.
So I have a quick question for Director Scott. I understand as far as the work that's been going in and the loss that has been learning loss. I just don't know how you justify that to a parent that a kid life is lost. Learning loss versus life loss, I don't think that's really comparable. And I think what a lot of folks are saying is they want to have an option. So as a parent, I want to be able to have the option. I don't care about what the board feels or how they think. I want to be able to have the option to do what's best for my kid. Whatever that is, to be able to have that option. And I think what a lot of people are, at least what I've been hearing, is that with the online learning, maybe expanding that, so parents have that option to choose what they feel is best for their kids and not make it they have to either do one or the other, but just have that option. So.
Yeah, and what I thought I heard from staff is that with that wait list, you continue to look at that and continue to potentially add. I heard optimism there in terms of being able to get through. 150 people on the wait list. So not a promise, but at least continuing to work through that. Yeah.
And I think the demand for online learning is higher than what's on our wait list. That's what I suspect. I don't know how we would test that, but I believe just from the amount of mail I'm getting, I believe that there's a demand for online learning. There's families that just don't feel safe, and we're talking about our enrollment data, and I think that's directly related to people not having a sense of safety. And it might be just safety for a time. It's not forever. We will all have to behave differently from now on. We're not going to ever eradicate COVID. But for the schools, and until we get children vaccinated, I would rather err on the conservative side personally.
I'm going to push back a little bit on the notion about demand and just go back to what we heard from staff about outreach and about the pretty intense communication in a lot of different channels, letting people know that the online option is available and here's how you pursue it. I think, we have maxed out and we've seen that, but I think our families know that it's an option. So I don't believe that there are a lot of families who are seeking that option now who haven't made it known in response to the outreach. I do believe that people's views may be changing and people may be getting, more nervous and scared as we get closer to the start of school, which is totally reasonable.
Yeah, it's okay to disagree with me, but I disagree with you. I sense that there's a higher demand now in this last week before school than there was 2 weeks ago or 3 weeks ago, as we've got lots of fearful news coming up. So I don't know how else we know the demand. I mean, we've contacted the 15,000 students that were in CDL, and of those we've had 500 applicants. No.
So, well, we've had about almost 700.
Almost
if you
700
add
with
up
the
all
waiting list and the
list, plus
500 that are enrolled.
Plus the people that have applied, got an offer and then rejected. So there's more than that. So probably closer to 800 have actually gone through the system. We're going to do another sweep. We're going to take another sweep at it tomorrow and in the coming days to say, like, if you're interested. Right now there's a wait list, but you're welcome to please let us know of your interest, and then we'll see where we are and we'll see what we can do. It is a dynamic situation, and we are responding to it every day. We are taking people off that wait list. So
I do appreciate the changing nature of your jobs. The logistical challenges are tremendous, and the stress is also tremendous. I know I'm up at night thinking about this for no reason really, except that we're opening in 8 days.
And Elizabeth
So-
raised the 3 feet, online learning for all and educators needing virtual positions. And I feel like hearing your then update, like about, Dan, your specifics about what does 3 feet and how your 3% of classrooms in middle and high school don't meet that and the steps you're taking to deal with that, how you're going to do that for elementary school. You've doubled the online learning, right? We've doubled it because it was 1 teacher for K through 5 and now it's 2. And we're continuing to be responsive to that. I don't know about the piece about the educators having virtual positions, but I feel like, yes, things are changing, and I see our staff constantly adjusting to that, including I'm really excited about the testing for students. I think that's one of the things we've seen in school districts that have gone back. Like I've contacted people I know around the country whose school started in August and who we aren't hearing about the school districts who have started in August with masking, with very similar protocols to what PPS has had, similar vaccination rates, similar community spread, and they have not had big COVID outbreaks. They haven't had quarantine. What makes the newspaper are the things that are scary. And yes, this is scary. Yes, we need to protect our kids. And it's not this zero-sum game of either like kids dying or being online. I think Andrew said it perfectly about this tension we hold of not being in school. We heard from the mom, Mrs. Chang, about what that was like for her as, the life preserver for her in some ways. And so it's complicated. It's more like asking, instead of candy or eggs, it's like, do you want cereal or eggs? Like there's good to both. And so it's how do we live in this tension of there's not one right answer, and we've got 50,000 students, and how do we try to find a middle path that both honors those kids who desperately need to be in person, creates some safe spaces, follows the public health guidelines. And I think it's just going to be an incredibly stressful year as we continue to get new information and discern and do our best for families. But I just really want to thank our staff for the report we saw tonight had so many adjustments and updates, and I just so appreciate your responsiveness and how we're continuing to do that. And I'm scared too, and I'm also optimistic. So it's that tension of I want our kids back, I know it's good for them, and I don't want anyone to get sick. And so how do we continue to constantly adjust and monitor? And things that make me feel better is like the audit report that we got last week of, there weren't any findings. And so how do we continue to build on that excellence as a team to keep our kids safe?
Thank you. And it's okay. It's okay for us to hold 2 truths at once. And this is it is a difficult position to be in. I really like Director Hollins. You mentioned for people that are fearful of sending their kids back to have an option. And I do think that, it'd be great to see what the demand is once we do another sweep of that online learning academy. I sense maybe it's just my mailbox, but I sense that the demand is higher than what we think it is.
If I could
for a choice right now until we peak in mid-September or whatever.
Madam Chair, I have one question. When you talk about the sweep that's going out tomorrow, is that going to be specific like the first one, or is that just to everybody?
We're just going to send it out to just gauge if there's any, if we've missed anybody. This is another chance to do that. And then if I could just add one clarification. So some of you are probably getting mail too about class sizes are this or that. So that's also a very dynamic situation. Principals are adjusting their master schedule every day. And so as we are working with Dan and I are working with principals to make sure, can you have appropriate distancing in class? Some of the numbers we see on our data are not actually accurate. So that there are scheduling errors that happen that they have to go in and hand schedule some students. So some students may have two classes in one period. So that's the computer schedules people, and then we have to go and fix those errors. And elementary schedules are put into the system at this time of the year because they are, they stay together all day. So I would just also just inform you that those things are going to be changing up until the first day of school, and even after the first day of school when we do balancing. After 10 days, we look at the class rosters, and we are balancing constantly. So and that's what we've also tried to assure people that we are monitoring it every day, and we're going to continue to make changes. So
I appreciate that. Thank you. It's always interesting to me to hear the back end, like the other side of the story. It's very instructive. Thank you. I know student representative has a couple of questions.
Yeah, I had a few questions. So kind of my first question is, when we have to quarantine individual students or cohorts, what is the plan to continue on teaching or continuing on learning for those students?
It's a great question, and there's, it's a continuum. So if it's one student that is quarantined, there's going to be a few options for that student, which we are still working out. So in the old days, if you're out for an extended period of time, your mom or dad may come and get some work for you to do while you're home, but you're going to be quarantined for 10 days. So there's a few different options. We have digital platforms that students used last year, as you know, you use them, so we could make work available on that. The district is prepared, by the way, K through 12, to offer those lessons for every content area. We have those loaded into our learning management system, so teachers can use that. They can substitute their own lessons in place of the district created ones on those digital platforms. And then we're also talking about the possibility of students being able to join class by a G-Meet, but the teacher would be teaching, so you wouldn't have the full visual effect of it. But if you wanted to hear, that's a possibility some teachers may. So there's going to be a continuum of options that teachers have, depending on the number of students that are in or out. If it were, let's just say we're a whole class, and everybody was quarantined, then that class would be would have class virtually, CDL kind of option for that period of quarantine. So it kind of depends on the number of students that are out.
So if an entire class needs to quarantine, what would happen to the teacher of that class?
The teacher would still teach, as long as they were well and able to teach, they would teach remotely as they did last year.
Okay.
Yeah.
And then with the 3% of middle school and high schools classrooms not being able to accommodate the 3 feet, are there specific schools or areas in the district that are higher than that 3% of not being able to accommodate? Are there any places where schools are trying harder or need to try harder to accommodate for the 3 feet?
So I would say that those are so it's 3% of classrooms across those schools. In some cases, we're able to just move a class. So maybe it's just a teacher has one section that's over the capacity of the class, so we just move that period to somewhere. In some cases, it's going to be challenging at Franklin and Grant, for example. It wouldn't matter. I could give them another teacher, but it wouldn't matter because there's no space to put the other teacher. So that there are space constraints in some of our high schools that are going to limit what we can do. In some of our elementary schools, for example, the problem has been that the classroom was too small, so we needed to have another teacher to create another section. We've done that, or where we can do that. So it also depends on the area where it is.
Okay, and then do you have an example of a meal safety plan, kind of what that would look like? Just
You've read them.
Yeah, some good examples that we've seen. I'm going to forget specifically what school is. So they're looking to maximize the distancing that's in the cafeteria. So some schools, what they're doing, if they can get really close, they might take a couple of tables and put them in the hall. And so those will be on the hall, and then they'll be able to maintain their spacing. Others are using different spaces within the building to maximize that. So I know some schools are using the stages, for example, or they're using the gym to, again, maximize the distancing. Others are really looking to limit the time that students are sitting down and eating and saying, you have 15 minutes to sit down and eat. And if you need more time than that, then you can either go outside or you can move to another area. So lots of schools are using different options, and they're being very creative. And there's actually, when I think we've got probably about 60 of them submitted so far, it's really actually heartening to see how creative they are, how confident they are that they can meet the spacing and that they can pull off the indoor lunches.
And that's Plan B, right? So
That's Plan B,
where
correct.
would we expect to see Plan A's for lunchtimes posted?
There's no specific written plan. What we're directed to the schools was to utilize the outside space to the maximum amount that they can. So when it's lunchtime, we want them to prioritize go outside first, and if there's a situation that it's not appropriate to go outside, then switch to Plan B.
But and if I just to clarify or to add to that, on our website on the pps.net/back to school 2021, we have standard operating procedures. We just included the mealtime, a standard operating procedure, which details a little bit more of what we've shared with our staff about outdoor mealtime.
Okay, I don't know if it's on there, but I have one quick question about that. So at middle school, we have closed campuses, but at high school, we have open campuses, obviously. So for high schools, are we expecting students to clear the school for that 40 minutes?
No, you don't have to clear the school. Some students will choose to exercise open campus and leave, but there will be lunch. There'll be cafeteria service, and they'll be able to eat outside on the school grounds. So we're not expecting them to leave campus. No.
Okay, and then final question. With the start of school communications, will that be sent to students as well, or just like families?
Yeah, we've been working on, as you know, we have our student.pps.net account, and so right now working with IT to make sure that we're able to communicate some of the same communications that we share with families with students.
All right, thank you.
I think we've heard. I don't know if anybody has any final comments, but we've kind of.
I have one more. Just a follow-up.
Yes, please.
Thank you. So a follow-up what you're saying about the sweep. The email going out tomorrow.
Yeah, we'll see.
So if we find out that there's more folks who wants the online learning, what are our plans to do with that? If we see there is an increase in numbers that parents do want to do that.
So we're going to look at the data that comes in, and we're going to, and then we'll come back with some recommendations based on that. I'll go talk to the superintendent, and again, we're going to accommodate as many people as we can in that option, and I'm hopeful because of what's happened the past 3 weeks. We've been able to clear those lists pretty regularly. So we just right now the only reason you see that many numbers on there right now, quite honestly, is because we took a pause to get the school staffed up, and then once we do that, then we'll so. That number would probably be lower today had we not taken the pause to wait for those processing to happen.
Keep us posted.
We will.
Thank you, staff, for your dedication and for your hard work. I know this again is it's a very challenging operating environment, Superintendent. Just very stressful. Just appreciate the time and attention you've given, and you've heard the themes of spacing and lunch plans, and it sounds like that's forthcoming. We can expect updates tomorrow and Tuesday. And so, yeah, I appreciate it. Thank you so much. We're adjourned unless we have any other business.
Only to say it's our last board meeting before the first day of school, which is in 5 working days. So we're excited to welcome everyone back. On top of that, we are living in this context. And so I just want credit for my homework because the board was very clear in 6 things it directed superintendent to accomplish, and that was prioritize full-time in-person school. That's happening. Follow all federal state guidelines. We have. Give families choice with a virtual learning option that is actually more rigorous and maintains a full-day connection with teachers. We're re-advertising that so that families can indicate a preference. Then we can evaluate where we may need to reassign and train staff to be ready for that. We might need to have a soft start, realistically, just logistically, to do that. That was the 4th thing. 5th thing, work with all your partners, MESD, Multnomah County, Community-based partners, we've done that all summer. Communication, hopefully everybody has experienced the barrage of information, and a comprehensive one that you heard is coming before the start of the school. And then 6, work with ODE, governor's office, and other state entities to influence and advocate and make sure that those guidelines really help serve students. We've been very active in that regard. So I just want to point out the board's 6 directions to superintendent. I think you've seen evidence that we've done our best to implement.
Thank you. I appreciate that. And that the work and the effort and the following of those directions is not lost on me. But I again had to voice my concerns. So I used an I statement about how I was feeling and my fear, and not about wasn't a judgment on anybody or anything, but rather how I was expressing my own fear.
I appreciate that, Chair, and I just want to make sure it's unambiguous to our community how much I share your care and concern for our students and for our employees. We'll continue, and I think we've been as careful as any school system can be around all of our health and safety mitigation strategies. They won't be perfect, I guarantee you, but I know that everybody's going to do their best, and we're going to try to make sure and take care of folks who really do need a different kind of choice for whatever their circumstance is, and that's really what we've been working to try to do.
Thank you. I think we're adjourned.